What is the QuantiFERON-TB Gold test for TB? Imagine a simple blood test that can help detect if someone has been infected with the bacteria that cause tuberculosis. That's what the QuantiFERON-TB Gold test does. It is a blood-based screening and diagnostic tool used to identify infection with Mycobacterium tuberculosis. This bacteria can cause tuberculosis, which can be either latent or active. Latent tuberculosis means the bacteria are in the body but not causing symptoms or illness. Active tuberculosis means the bacteria are multiplying and causing disease, often with symptoms like cough, fever, or weight loss. The test works by measuring how the immune system responds to specific parts of the TB bacteria. It checks for the releases of a protein called interferon gamma from white blood cells when they recognize TB antigens. These antigens are synthetic peptides that mimic parts of the bacteria, such as ESAT6, CFP10, and TB7.7. A blood sample is drawn into special tubes containing these peptides. The sample is then incubated for about 16 to 24 hours, giving immune cells time to react if TB infection is present. After incubation, the amount of interferon gamma released is measured using a laboratory method called enzyme-linked immunosorbent assay, or ELISA. If the immune cells produce a significant amount of interferon gamma in response to the TB antigens, it indicates that the person has been infected with TB bacteria. The results are interpreted by comparing the levels of interferon gamma in the TB antigen tubes to control tubes. The controls include a nil tube with no antigens and a positive control with a mitogen to ensure the immune system is capable of responding. A positive QuantiFERON test suggests TB infection, but it does not tell whether the infection is latent or active. To determine if the disease is active, additional tests like chest X-rays and sputum analysis are needed. The QuantiFERON test has advantages over the traditional tuberculin skin test, such as requiring only one visit, providing objective numerical results, and being less affected by prior BCG vaccination or exposure to other mycobacteria. This test is widely used around the world and is recommended by health authorities for TB screening and diagnosis. It is especially helpful in populations where BCG vaccination is common, as it reduces false positives. While a positive QuantiFERON indicates TB infection, it is important to remember that further medical evaluation is necessary to confirm active disease and decide on treatment. Always consult healthcare professionals for interpretation of results and appropriate care. The QuantiFERON-TB Gold test is a valuable modern tool that helps health providers identify TB infections more accurately and conveniently, supporting efforts to control and prevent tuberculosis globally.